So, it's not seasonal allergies, it's an upper respiratory infection, and your provider is pretty confident it isn't bacterial. What do we do? For pain and discomfort, evidence-based practice currently supports the uses of Tylenol and NSAIDs. The effects expected from these medications are simply fever reduction and reduction in pain. For broader symptom relief, it's also advised that you use antihistamines and decongestants. Systematic reviews have shown that this may bring relief such as headaches, nasal congestion, sinus congestion related to your upper respiratory infection. Antihistamines may reduce secondary mucus production, and decongestants should help reduce symptoms like sore throat and cough due to reducing postnasal drip. Negative side effects to antihistamines and decongestants. Often they cause you to have dry mouth, dry nasal passages, and you could potentially get a subtle headache. Now for supportive therapy. Saline nasal sprays or saline nasal gels may remoisten nasal passageways that may be excessively dry related to the decongestant's side effects. In addition to that, honey has been shown to reduce cough frequency and severity and may provide some relief for a sore throat. There is mixed evidence on the usage of vitamin C supplementation such as Emergence C in reducing the duration of symptoms. Lastly, I want to discuss humidified air in loosening and softening of mucus that causes these symptoms. Did anyone notice how similar these treatment plans end up being compared to your seasonal allergy management? The majority of treatment plans here are the exact same as you would be advised for seasonal allergies. In receiving the diagnosis of a viral upper respiratory infection versus allergies, the biggest, most directly actionable thing is the consideration of if you need to take additional protective measures for those around you. Upper respiratory infections are transmittable, allergies are not. When a upper respiratory infection has been in the house, washing of surfaces and wearing of medical masks may protect others in reducing the transmission of the illness. General rules of thumb: common colds or rhinoviruses are contagious for 2 to 3 days after symptoms appear. Flu is from 1 day before symptoms to potentially 7 days after the first symptoms. COVID is contagious, generally speaking, for several days before the symptoms, up to 10 days after first presentation. Generally speaking, if you can stay home, do stay home. Wearing of a medical mask, washing of hands, cleaning of surfaces are all reasonable methods for reducing transmission of upper respiratory infections. How long until you should feel completely better? Sadly, upper respiratory infections can take several weeks for complete cessation of symptoms. The biggest concern is if after an initial improvement of symptoms drastically increase or new ones arise. This may point towards a follow-on bacterial infection.